Hi, Tim. Good morning, everybody. Sorry, good afternoon, everybody. I'm sorry for the slightly late start. We are doing, we're ending the year as it began, fighting with Teams, Zoom, phones, anything else we can. But thank you for joining us today. The aim of this discussion is really to be helpful and to share experience across England around the community mental health framework. As you will have heard Rethink say before, and other charities in the mental health space, this is one of the most exciting things to happen in decades. It would be a challenge to do it at any time, but let alone with the coronavirus pandemic taking up so much of the year, the challenge is more keen than ever. And I think if we look back to the time before the pandemic, before Teams and Zoom, the community mental health framework and the transformation of working differently in the community always looked like the best possible solution. I think with the level of need and disruption we've seen this year, it now looks like the only solution to really involve all the resources in the community in finding the answers around community mental health. I'm delighted here to have some amazing speakers to start off by sharing a few of their experiences and then hear your questions. We're all in this together in the sense it's a huge challenge for everyone. So we're hopefully going to share our experiences and our learnings as openly as possible. Any questions that aren't picked up during the session, we'll put them in the chat and we'll respond to them later. So I'll be delighted to introduce in a second Samantha Holmes, who's our co-production manager at Rethink Mental Illness, Tim Baverstock, who's the Deputy Director of Adult Social Care at Somerset County Council, James Sutherland, who's the Programme Manager for Primary and Community Mental Health Transformation Programme at NHS Sheffield CCG, Aileen Edwards, who I've worked with closely in Somerset. She's the Chief Exec of Second Step, a major charity in the Southwest working around SMI and other things, and Dr. Emma Tiffin, both a GP and an advisor to NHS England and Improvement. Hopefully all the speakers are now online and ready to go. We may have to put the order around in a bit, but I'm going to ask each person to introduce themselves and where they're from in terms of the conversation today. And also, hopefully everyone knows this, but I'm sort of speaking slowly at this point, so anyone who missed this bit of briefing has got a moment to think on their feet, to kind of share their best top-level tip for overcoming a barrier to this transformation that we're all trying to undergo. So let me start by moving over to the speakers and start with Samantha Holmes.
Thanks, Will. Hello, I'm Sam Holmes. I'm a co-production manager at Rethink Mental Illness, and I work to put co-production at the heart of our approach to collaborative working on community mental health service transformation.
Brilliant. Thank you very much, Sam. Do you want to share with you your best tip about?
Oh yes, sorry. Yeah. So my best tip for overcoming barriers is having experts by experience on boards, on working groups, on locality teams. So really embedded in the the joined up approach and the system, bringing the lived experience, real life perspective to all of those shared considerations and decisions, and doing that, it can often that perspective can often facilitate consensus and also collaborative approaches.
Thank you very much, Sam. I'm going to move now, if I may, to Tim and ask you to introduce yourself.
Hi, yeah, good afternoon. Tim Baverstock, so I'm Deputy Director of Adult Social Care at Somerset County Council, with responsibility for all things adults, and in particular commissioning of all adult services, which obviously also includes mental health and learning disabilities as part of my remit. So I guess if I sweep straight into a kind of tip, it would have been you've just taken mine, so there might be a running theme here. But I think, you know, I was in a very fortunate position as a lead commissioner, and obviously this is NHS funded transformation, and therefore what I would say is it would have been really easy for our trust in Somerset and for others to do more of the same. Let's put it like that, and they could have taken the approach that actually we've had underfunding in mental health. We need more of our community mental health teams in their traditional sense. But absolutely fair play to them. They didn't. They involved the local authority incredibly early in the process. We likewise involved the voluntary sector, and I don't want to take any credit for that, but I do think bringing the voluntary sector in so early and showing clinicians what was possible would be my best tip, because it was really exciting to see that whole change of emphasis in terms of, you know, what was actually possible out there in the communities, particularly in a place like Somerset. And at the same time, as I said, you have pinched it. We did also bring in peers and users of services. And again, I think I've described this before on one of our webinars. There was very much a light bulb moment for some of those clinicians who were probably doubting a little bit that we could do something different, when, you know, some of those peers came in and said, actually, this is what we need. And we then designed around that. You know, my advice would be, if you think something's not possible, look again and have a go, because if you have a go, you can end up with something that's, you know, really quite amazing for the people that we're supporting. And I'm sure Aileen, who's on this call as well, will hopefully agree with that.
Brilliant. Thank you very much. I believe we're still waiting for James to join. So if you can make yourself known when you're here, I will go straight over to Aileen, if that's right, to introduce yourself and give a top tip.
Yeah. Hi, everybody. Hopefully you can hear me. Aileen Edwards, I'm the Chief Exec of Second Step. We're a regional mental health organisation working with people with serious mental illness, but also around complexity as well. And we are delighted to be part of the Somerset Trailblazer with Tim and Sam and Rethink. And also we work in BNSSG, so Bristol, North Somerset, South Gloss, CCG. So very different from Somerset. Some similar challenges, some very different. I'm going to be cheeky and have two top tips. So one of them, and you'll know this, Will, is really making sure that people invest time in building relationships, because those relationships are going to carry you through the tough times as well as the kind of successful times. And we can't underestimate how important it is to build those trusting relationships. And then secondly, the VCS, absolutely fantastic that the expectation is that we're centre stage in terms of delivering the community mental health framework. I think for commissioners and other providers, it's really important that they understand what they value about the voluntary sector, small niche providers, grassroots organisations, and the bigger providers. What do you really value about that? Do an exercise of writing down what you really value, and just make sure you test out that everything that you're doing maximises that value and doesn't undermine what you're trying to bring into the voluntary sector. So those are my two top tips.
So to work out at the beginning what's most valuable about the voluntary sector's contribution and not undermine that.
Yeah, because I think sometimes what happens, and we've had experiences of this, is sometimes you kind of end up in the centre ground and you lose what you really, why you wanted the voluntary sector to be there in the first place. So we now do is put what we value about our partners, what they value about us, have that centre stage, and then you can come back to it and say, is what we're doing helping or hindering that? And to make sure that we're not losing the value of the partnership, of what we're trying to do. So yeah, I think that's, we're finding that's really important, because you can always come back and say, actually, we're becoming NHS light or something like that, or social care light, because of our processes. Let's make sure that we really understand what we want to preserve and protect and maximise of the voluntary sector.
Brilliant. Thank you all. Thank you all for the tips, and thank you all for introducing yourself. While we're moving along in a stately fashion above the water, below the water, there's some frantic technical work to get Emma and James on. So Emma's joining in a couple of minutes. So what we're going to do now is just sort of take the temperature of where people are already up to and move on to the, I don't think I can say this word, the Mentometer, which is the tool we're going to use to just see how it's all going for you, in your area. So if you can follow the link on the screen, there's going to be 2 questions to answer. It's all anonymous, so unless you somehow give away who you are, it's completely anonymous, and therefore you can be really open. And there's a question on how well you think your area is, and you don't have to be in the NHS to answer this, but how well your area is prepared for the final proposals on the 20th of January. And then there's a question about the primary challenges, which we'll then put to the panel, which is growing as we speak. So it's funny talking into the void like this. I hope that all made sense, but can you follow that link? And yeah, can we show the code again, please? Give everyone a rest from my face and go back to that presentation with the code again, or put it perhaps up in the links. No, just 1 second. There we go. So I can see activity there. Blue dots are appearing, which is a good sign. Can someone put the code up in the comments, please? Great, and welcome to Emma. Brilliant, they're all coming in. Thank you for putting the code up. It's in the comments now for anyone who's still struggling. We'll give that a second more. There's a lot of clustering on points 1 and 2 there. Brilliant. So looking at that, as they always say on Question Time, unscientifically chosen audience, there's the biggest cluster looks to be on this very tiny screen. So someone come in and correct me if wrong, looks to be on point 3, which is a few things on track, but lots of things to sort out. So timely to meet today, and I think probably useful for everyone to know they're not alone. As I said at the beginning, this is a very challenging time to do a project that's wholly new. And I think knowing that one's not alone and that it's all right to do this in stages, iterate and improve it, I think is vital for this thing the transformation not to become overwhelming and sort of cliff edge looming up in the new year. So shall we move on to the next question? So primary challenges. Can you feed in a word cloud what your primary challenges are around community mental health transformation? And again, you don't have to be only from the NHS to do this. Welcome, of course, NHS views. But from where you're sitting, this is a transformation that has to involve everybody. What do you see as the challenges? And And welcome, Emma. Sorry for the troubles of joining. We were saying at the beginning this has been a year of Teams. We'll ask you to introduce yourself very shortly. Time. Well, time is emerging incredibly strongly as a theme. And welcome to James. I'll also ask you to introduce yourself. We've got everyone just being very honest that there's still a lot to be done in this space, just as you'd expect, and people are putting up their challenges, which we're going to ask the panel to respond to. We'll give that just a few seconds more. It seems to be populating nicely. Brilliant. Thank you very much. It's growing as we speak, but I think that gives us a flavour. We've only got so much time ourselves to work through the issues. So let's move on at this point, giving the presenting team a hearty hint that time and capacity seem to be coming out really, really strongly. I'm just going to turn to both Emma and James to introduce themselves in turn, where you're from, and any top tip around transformation you want to give of how you overcome blockages. So Emma, then James. Hi, Emma. Emma, can we hear from you yet? Sorry about this. I'm going to start with James. I'm going to move to James now, if James can come in.
Good afternoon,
James.
everyone. Many thanks to Will and colleagues from Rethink for the opportunity to participate this afternoon. I'm James Sutherland. I'm the Programme Manager of the Primary and Community Mental Health Transformation Programme in Sheffield. I've got probably 20 years of experience working in the mental health sector, ranging from substance misuse, operational management, a lead commissioner for substance misuse, also set up and was a founder of a VCSE organisation that provided support for substance misuse and mental health conditions. And for the past 12 months, I've been based in Sheffield, working as part of one of the 12 early implementer sites for NHS England for the Primary and Community Mental Health Transformation Programme. It's a really exciting and equally challenging time for us, but my top tips, I've heard the importance of relationships, also of the service user and lived experience. I think for me, this is about ensuring that we have relationships. We're commencing on a 3-year journey of change. I think my top tip is to be bold, to test out new ways of working. There are incremental growth monies that allow us to test, to develop new partnerships, new ways of working that address health inequalities and improve the service user's experience of care, support and treatment. I think my other top tip would also be that if we design using yesterday's processes, this will be the future that we will inherit. So please be bold, be transformational and be aspirational.
Brilliant. Thank you very much, James. You're very welcome. And apologies to you and everyone here for the technical difficulties in getting through Teams. Emma, I know you were here and I know you were struggling with mute, so at the risk of making life even more frustrating, I'll just give you another chance to come in, or the team will take care of the issues. I'm going to take that as Emma's dialing back in. We'll introduce ourselves there. So I'm going to turn back to the panel and looking at that word cloud, the issues around the competing pressures of COVID, of capacity, of time, really sort of came out to me as a major issue. So in terms of troubleshooting, I'm going to turn to Tim and then Aileen, and then any other thoughts from James on that capacity and time issue. With so much going on, how on earth do you take an already challenging issue and find a path through this? So, Tim, any thoughts from you?
Just a small question, Will.
Yeah.
And I think, I can't be cognizant of other people's challenges. I'm sure we're all facing, particularly because of COVID, significant redeployment issues and other things that are going on. So, I don't want to pretend to be, a mentor in that respect and understanding everybody's challenges in that way. What I would say is that one of the advantages of opening this up, as everybody has said, as widely as you possibly can, is that you can share some of that time challenge and that resource challenge. And in reality, and I think it was the last speaker that just said, if we designed in our little commissioner clinical bubble, we probably wouldn't have the time to do it, and we'll get it wrong, because we will just follow previous paths. So by widening it up, opening it up to voluntary and community sector, social care, social workers, etc., and getting plenty of different views in terms of how you work, and then bringing in the peers and people with lived experience, or just those who actually think that, these may be services they might need in the future. That was another thing that we did do, which people tend to forget. It's not just the people that have been through it. Then I think you do carve out that time and resource, and actually it makes it easier in a way, because what we tend to get, and I'm generalizing, us in the business, I will put it like that, tend to get hung up on structures, the way that we work and all of that. Actually, all of those people I just mentioned don't get hung up on any of those things. They get hung up on what's best for the person and how do we get about designing some of that. So I realise it's extremely difficult. The other kind of flippant thing that I would say is, this is a fantastic opportunity from a funding perspective that we've all been asking for a long time. We were lucky in Somerset to be trailblazers for this, and I guess timing wise that's worked out better for us. But we can't afford to let this opportunity go to waste, and it's so based on what people have been asking for and where our gaps are, that it will actually free up time 3 to 6 months down the line, because your teams will be working in a completely different way.
Brilliant. Well, there you have it. Invest time now, save time later. Investment opportunity. Aileen, do you have any thoughts on the time capacity issue?
I support a lot of what Tim says, and I think actually in COVID we've had to work in different ways. The boundaries between commissioner, provider, etc. has really broken down, and it's been fantastic actually. In Somerset and also in Bristol, North Somerset, South Gloss, that things that have happened that before would have taken forever actually have gone really quickly. So I think we have to build on the relationships and the ways that we've been doing things in COVID to make sure that we're more adaptive. We need adaptive leadership, we need adaptive systems, and we need adaptive organisations, and that's the kind of culture that we want to promote, that we've had to engage with in COVID. So that way of kind of being leaders for the system and not just for our own organisations, really important. And I think what Somerset did for the Trailblazer was fantastic, in the fact that they said we want the voluntary sector to be absolutely an equal partner, and asked us how and what we wanted to do. They didn't tell us what they wanted us to do. So as Tim was saying, is use all your resources. So one resource was the voluntary sector. We came together as agencies and we worked on what we thought we could offer as a voluntary sector, and then came back to the Somerset Foundation Trust and the CCG and social care around that. So it's around dispersed leadership, really important that you reach out, have diverse views, but also build on where you have strong relationships. There will be good relationships with the voluntary sector. Let those leaders in the voluntary sector build forward. I also think it's have the vision, have an agreed vision, and build forward, knowing you can do things in bite-sized pieces. That you don't have to do it all in one go, but build it forward, and find out where the momentum is as well, and ensure that everybody is thinking about the whole system and not just as their own individual, through their own individual lens.
That's brilliant, thank you. And I suppose if there's one, I'll turn to James in a second. If there's one thing we would want to take out of this year, a year of COVID, of Teams, of Zoom, is keeping that kind of agility and that distributed leadership and quick decision making going in the world we're heading into. James, may I turn to you? Your thoughts on how to make this transformation
happen? Many thanks, Will.
What's going on?
I would really echo a number of the points that have been raised. Certainly, it's a challenging time. I think for both Somerset and Sheffield as well, is through 2 lockdowns, through a series of different tiers that we've moved through early implementer sites, we have still been able to begin the transformation journeys and actually use those new and different ways of working. I think, as what was just alluded to, having that governance, that senior sponsorship, working of having dedicated and empowered individuals who can lead and champion and are actually empowered to make those decisions that actually facilitate and enable the change. I think there's a really important point just raised as well about actually breaking things down into those more manageable, those bite-sized chunks. The funding that's flowing through us is substantial. It's not going to necessarily be enough to achieve total coverage in year 1, so you've got that 3-year period. I think a key point, coming back to the principles that we've all heard about, lived experience and service user engagement, has to be as well starting to reach out to new partners, to develop relationships, to also work with our wider colleagues in the local authority, most importantly the voluntary sector, but to do that engagement work so we can design something that is needs-led, it's informed by local communities, and those priorities are set by local communities at a local level, and we stop trying to design services on very, very large footprints that talk to everyone but perhaps don't address anyone's needs.
That's brilliant. Thank you, James. I'm going to just we're going to pick up 2 more issues that came in really at large in the word cloud, and one is relationships, and I'm going to turn to the panel in a second and ask, really in a kind of a sort of open and granular way, what is it that makes a relationship different, that provides some of this extra capacity, so it isn't just an NHS issue, but you've got the capacity of the wider community to draw on. How do you go about making relationships that are different? And then we'll look at co-production, what faux co-production is, to pick up a term of this. But before I do that and turn back to the panel, I'm just going to see, Emma, whether you're with us and audible.
Can you hear me now? Is that
yes,
good?
We can. Emma, thank
Miracles
you so much.
happen.
1,000 apologies.
No,
would you
don't worry.
Mind introducing yourself and perhaps giving one top tip on how to achieve transformation? Everyone's been very open, that people feel it's all very exciting, but there's still a lot to do. It'd be great to hear your top tip.
Of course, yeah. So I'm Emma Tiffin, so I'm a Cambridgeshire GP, practicing GP, and I'm also the STP Clinical Mental Health Lead and National Advisor for Community Mental Health and Primary Care for NHSE. And I think for me, it's very much been around the need for primary care to jointly own the mental health agenda. I mean, actually 90% of mental health needs are managed in primary care. So obviously it's key that both primary care and mental health work really well together. So I think my top tip has been around, we've invested heavily in primary care mental health leadership. So we appointed a local GP for the Peterborough area, which is where our exemplar is, to help me out in terms of actually leading the change, particularly the cultural piece, which I think is a big change, you know, looking at putting mental health specialist mental health into a community primary care setting, and also appointing and contracting for mental health leads in the 5 PCNs in our exemplar area. And finally, in terms of still on the topic of primary care leadership, making sure that primary care is properly represented on all our mental health governance boards, so they have an equal voice, much like our third sector do and our patient group. We have primary care absolutely at the table and taking joint responsibility for community mental health and for the new model. Because unless primary care sign up to that, I think it'll be very difficult to achieve true change, which is what we need to benefit our patients and carers.
Thank you, Emma. Brilliant to have you, and a really timely point, because we need to put primary care at the heart of this. I just to people listening, recommend again the guide that Rethink with help from many others of first steps for STPs, published just about a month and a half ago, which tries to break down the big transformation task into a few easy steps. We'll put the link up in the comments. But the thing there about getting the right broad leadership team in place in an area at the start is really important, and I think speaks to what Emma was saying about primary care. I'm just going to turn back to the panel now with this question about relationships. We've stressed the need to build relationships. They allow us to respond with agility, they add capacity, and they fulfill the kind of the vision of the community mental health framework. But I want the panel to try and be explicit about what has to be different to make relationships deliver different things in an area. And James, if I may, I'd just like to start with you, see if you've got any thoughts.
So I'm having to unmute myself with a key code on the telephone, so apologies, there's a slight delay. I think the relationships are key. We need to rapidly build mature but open and honest relationships. And I think as well the crucial part of this is there are multiple different actors within this transformation, and it's about being able to look through the lens of other partners, also to see things from their perspective. I think from my role as a program manager as well, I see things very much as my role sits across not just the CCG, but across our mental health trust, across a voluntary sector provider, which is Sheffield Mind, and also our primary care at scale provider. Within that as well, it's almost having various different pieces of the jigsaw or tools. I think one bit is actually how to collaborate, but also to facilitate the change across those groups and understanding how so the groups can move forwards with this transformation in a cohesive manner, as opposed to it perhaps being a bit more fractured or splintered. So I think it's investing that time into those relationships, building those relationships, but also facilitating the change as well and supporting those organisations.
That's brilliant. Thank you very much, James. And I'm going to turn, Aileen, with the same question to you, but just to add into it a question that's come up in the comments. And I'm going to encourage you to be, as I know you to be, very fearless on this. How do you stop in building these relationships? NHS providers sort of overpowering the third sector, or how do you keep that relationship one of real innovation partners rather than I'll say what you want to hear to get your money or whatever it is?
Yeah, good question. And I think it is about thinking about those we've got to think about it being an equal partnership, and clearly when you've got a big statutory agency like a mental health trust, that can dominate. But I think as I said, as my top tip is about kind of what do you value about the different partners. Obviously, the clinical expertise is valued by the voluntary sector. What does the trust value about the voluntary sector, and how do you build that in and protect that uniqueness? What you can't do, as I said, become an NHS light kind of version of a mental health trust, because otherwise you've lost all the things that you're trying to achieve through the voluntary sector. So some of the things that we've done in Somerset, and we're talking about in Bristol and North Somerset and South Gloss, is really building capacity in those smaller, diverse, place-based, maybe single focus organisations to be able to engage. How to be able to fund their capacity to engage. I think that was incredibly important in Somerset that we did that, to enable those organisations to engage, because otherwise what happens is you end up with the big voluntary sector organisations being the only ones that are around, which is not at all what you need in this transformation programme that we're going through. You want a real diverse mix of voluntary sector organisations. I think also it obviously is about building trust, and it's building trust within the voluntary sector as well as outside of the voluntary sector. And we know that we all get tripped up from things that have happened in the past and things that are happening now. And I think it's about how do you really appreciate the partners. No one organisation can do it on their own, and it's appreciating the diverse the diversity of providers that's required. I think it is always also about having good relationships at all levels in the organisation, so not just operationally but also at leadership, where you can have honest conversations and you can give honest feedback. Obviously that does require a maturity of relationship, but I think that certainly that's something that Second Step we work really hard at, is making sure that we appreciate where the appreciation and thanks is absolutely important, but also to say this isn't quite working for us, and to give that kind of feedback, and to be able to also to be open and inquiring about how we could do things better. So investing in those relationships is so important. The other thing I think is also to help that is to have reflective time. Things can become, and I think one of the challenges is when you've got a big program, it can be very transactional. You get into how many staff, and I know this is what NHS feedback's been recently. Your first admission didn't say how many staff you were going to employ. Actually, this is a transformational program. Although that's important, it's also getting the culture right and the ways of working right. So you need to have reflective and headspace as a system to have that reflective time. So we would always really encourage some system facilitation and investment in that development of the culture of the system. Otherwise you may get more of the same.
I think that's a really crucial point, and it's worth recognising the challenge that even in the trailblazer areas, it was delivery money brought forward. There was no sort of specific time or resource investment in building the relationships, and it will take time, and it won't happen overnight. I completely agree, Aileen, and it's funny how often there's someone who works for a large mental health charity. I find myself saying that you don't need just mental health charities. You need all the charities that represent the support available in your area that people will need or say they need. And you also need not just large charities, you need to find a way of involving even micro organisations in a way that's meaningful and empowered for them. So with that in mind, I'm just going to turn on the relationships point to Emma and ask for your thoughts on relationships generally, but particularly any thoughts you have on this working with the voluntary and community sector world within that as well. Right, Emma, it was, we shall.
Hello.
Oh, brilliant, brilliant.
Hello.
Hi, we can hear you.
Hi. Well, I don't know what's going on with the tech today.
Well,
no, but I could hear her. So thank you for the opportunity to come in. Yeah, I mean, relationships are key, and I think it's really important that the third sector, as well as our service users and carers, are on all the governance and delivery boards and have a voice at the top table. And what we've done is very much, we hope, listen. So with our third sector and with primary care, there were a number of things that they highlighted that were important for the transformation. So one of which was around looking to give grants to our ethnic minority groups, who in Peterborough we have quite a few different ethnic minority groups, so that they would be able to look at access, what was needed, and other all sorts of how we used our different third sector organisations. We did the same for rural communities as well, and again that was very much the result of listening to our third sector, knowing communities, and that was the feedback that was what was required. And I think also health connectors as well, so just how we support people to access health, the social prescribing community assets which our third sector offer and support people with, but as I say, in a very proactive way, so connecting statutory and non-statutory services. And lastly, I would just say it's really important when thinking about relationships to think of it at every level, so from those at the top, the decision makers, but also the teams on the ground, making sure they get on, they communicate well with each other, so that every patient has a really good plan, which, as I say, might involve both statutory and non-statutory services.
Brilliant. Thank you very much, Emma. I'm going to turn in a second to the bit of the word cloud about co-production. I just want to pick up first a question that's appeared is, are all areas supposed to have implemented most or all of the transformation by April the 21st? April 2021. And our clear answer, I mean, NHS England has stepped slightly behind the curtain while it's looking at the proposals, but everything we understand from NHS England is that the answer is a sort of straightforward no. This is about the need to have a plan, and in some cases, a plan to have a plan, to begin rolling out, to iterate, to learn along the way, and to head towards the end of 24-25. And I think the reason it's worth labouring this point is because if you were expect to produce a transformed system by April next year, you'd either have to sort of make one up without the kind of co-production, without the engagement we're talking about, or the whole thing would be feeling frankly so forbidding it would become a hot potato passed around the organisation. So our sense here is there's a lot of permission to be on a journey and to do this step by step, and to continue evolving it as it comes. But I'm going to turn now to Sam, if I may. In the word cloud, there's something about co-production versus faux co-production. There's also a question about how we reach out beyond the usual suspects and recruit widely. Can I ask you to speak to those?
Yeah, sure. So yes, it is really hard in COVID working remotely to form relationships with experts by experience, to get them involved in this transformation and to have those conversations. In Somerset, we were lucky because we had the chance to set up a group of expert by experience leaders before COVID, and we've managed to sustain that remotely throughout. So my tips on, and we are obviously doing this now in other areas, is I think you have to see who, and I know this like with the, and I appreciate that the usual suspects, the usual participants, I prefer to say, question here, but I think you do need to start with who's already, who partners are already working with. So that might be from the trust, that might be peer support workers from the trust, it might be people from the Recovery College, and from the VCSE partners. So you do have to start there, and then you have to find ways of having meaningful discussions about the key sort of pivotal transformation considerations where you need that lived experience input on, and that needs a lot of facilitation, and it needs space and time for one-to-one conversations as well, because people need to get their heads around it, and it needs a lot of support, and then from there, and I think there was some questions were sent in beforehand around more diverse engagement, and the way to do that, and yeah, absolutely do need to try from the outset to do this is to have conversations with community leaders, and just think about where those underserved people are who aren't having conversations about mental health, and through those community links, try to set up spaces where those conversations can be had. And with thinking about the language that you're using, thinking, just doing it in a culturally intelligent way, but it absolutely, we should, even in this remote context, we should definitely aim to do that, or actually do stuff to try and achieve that. But it is it is challenging, and it does take a lot of thought and time and effort.
Will, you're on mute.
It was all gold what I was saying as well. It was brilliant stuff. I was just saying thank you, Sam. And there's some there's examples of job descriptions for experts by experience in the guide we published. We're also seeing, quite excitingly, in parts of the country, the NHS working imaginatively with small community groups to increase its and charities and community organisations to increase its sort of recruitment of experts by experience. But thank you very much, all the panel. I'm going to go around you all one more time for last thoughts, but I'm just picking up there a lot of permission to be bold, a recognition of the time to build relationships, and also the need, well, action has to start now, and the proposal's due in on the 20th of January. There's the time and the permission to iterate, to get it right over time, rather than see it as a big bang in April. So in some words, troubleshooting was a sort of unhelpful title for this webinar, because we'd be expecting to be kind of dealing with trouble at this point as we kind of begin to build it. So I'm going to turn back to the audience, back to the panel, and ask Emma, then Aileen, then James, then Tim, then Sam, to give their kind of final thoughts from everything they've seen in the comments, the word cloud, the questions coming in. We'll send around the word cloud. We'll send around some more thoughts we shared with the panel based on the questions that appeared in the comments. Panel, can we turn to you and start with Emma?
Yes, thank you. So I think, we started on our journey with community mental health transformation in now 5 years ago. And I think you're absolutely right about the time and the importance of the co-production piece. So you really need everybody in the system to sign up to a common vision, common principles, and that's absolutely key for making this work. And I think we found the culture change, as I say, involved in, bringing in lots more third sector staffing, looking at the relationship between primary care, the mental health trust, the third sector and the local authority, really quite challenging. We're not just plonking some community CMHT model into primary care here. In our case, that's our model. We're actually looking at a whole different way of working where, nobody goes out of primary care, they stay in that setting and specialist interventions reach in. And I think with the co-production, it's key. At the end of the day, this is about solutions for patients and their carers, not for us. And that takes time. So I think it's really important to make sure you take the time, listen, and implement what we've heard. And I think in the NHS we often go wrong on that. So those would be, my main points, I think, and that would include getting primary care on board and listening to them as well.
Brilliant, thank you, Emma. Really open and useful, I'm sure, for everyone. If I can turn to Aileen. Any thoughts, Aileen, on the discussion so far?
Yeah, I think Emma's, what Emma just said was absolutely right about having a shared vision. I think you need to, as I said before, I think investing in the transformation, such a fantastic and exciting opportunity that we won't be talking about primary mental health and secondary mental health in a few years' time. We'll be talking about mental health, and that does require everybody to shift their ground and to develop new ways of talking about mental health, really putting the person at the centre. So, sorry to say this, but it is a journey, and I think if we all think about being on the journey together, and that nobody knows the answers, but we all can work together on the vision and recognise that we all got our part to play and all got our element to play, and we look out for each other. Think as a, as we're expected to do, think as a whole system, and really value, so we don't just become vanilla in our response, but really value the diversity and the fantastic opportunities, and build a strong foundation of relationships at all levels, and making sure that the person absolutely is at the centre. And we always go back and check, are we doing the right thing by the individual, and use some kind of checks and balances, and to make sure that we just don't fall into transactional things, but we have some time out to build the real transformation that this could do, because we've got to seize the opportunity and not waste it. So making sure that we have that time and that investment to do the transformational work.
Brilliant. Thank you very much, Aileen. James.
Thanks. I think I'll try and address one of the comments in the chat box, and perhaps in the spirit of different lenses, just to reflect on co-production and how we work effectively with our VCSE colleagues. Our experience has certainly have been that we listened to how the VCSE sector wanted to engage in terms of access to funding. We had to educate to some degree about what was possible, given that monies are flowing through CCGs, which are public bodies, which have procurement legislation that has to be followed. What we ended up doing in Sheffield was we designed an entirely new process. It was led by our third sector strategic partner, but in doing this new process, we removed traditional paper-heavy applications. We provided greater opportunity for collaboration, longer-term contracts, no rigid specifications. The content of what would have been a traditional tender specification was set by the voluntary sector's own descriptions of how they would meet the needs. I think responding just to one of the comments that was raised in the chat as well was, across our 4 primary care networks where we've been piloting the new model, we've managed to award contracts to 9 VCSE organisations, and also through co-production with service users, families, carers and wider partners as well. They met needs wholly that were identified by local communities, but also from the voluntary sector perspective, we moved away from the shackles of there being predefined funding lots or amounts. It was a total amount of funding that we put out there. And so actually it wasn't as restrictive as previous processes have been. So I think a key message from me as well is working with the voluntary sector is vital. If we are going to transform our espoused values into tangible actions, we need to look at how we can invest in our VCSE organisations through hosting staff roles, or where we want to invest into the provision of services to really start to work with our CCG or NHS colleagues about how we make processes compliant with legislation, but certainly much more light touch and VCSE friendly, and again, not repeating today.
Thank you, James. And just to sort of trail, in January next year, we'll be publishing a further STP guide, which goes into more detail around commissioning and other options. I mean, there's lots of ways of doing it, lots of ways of achieving those kind of fundamental principles that James is talking about. Tim, can I get any final reflections from you? You and Sam have both been, spared here. You've only got 30 seconds each because we're going to finish on time. So
I will be. I'll make this really easy then, Will, and just be super quick. So, some of the stuff will be in the guide next year, coming from Somerset and from a commissioning angle. So I think that will help. I was just going to pick up on a very similar point, and that is around VCSE providers. So, there is nothing wrong as commissioners in clearly signalling to VCSE providers that actually you're not going to accept a large VCSE provider on their own, and you need the diversity that in our case that Somerset brings. So very early on this process, and then I will finish, we actually used our mental health hub as a way of presenting this is the opportunity, very much like the last speaker described, and then myself and the CCG Commissioner and the Trust left the room, and we encouraged everybody just to talk amongst themselves around how could we work together on this, and there's nothing wrong with doing that. If you have a procurement colleague on your shoulder that tells you can't do some of this, tell them no, challenge back, and work with the sector for the good of the people that we're supporting. That would be my piece of advice, and there'll probably be some slightly less colourful language in the guide that comes out in terms of how you can do that.
Well, now you don't need to wait for the guide. You've heard it from Tim. Sam, we have to end now, but let's just have a quick thought from you on co-production.
So my thought is, where there's a will, there's a way. So have a plan, stay flexible, be creative to work out how you're going to achieve that, and do include experts by experience who have who are already involved and have already committed a lot of their time and expertise to system transformation.
Brilliant. Thank you so much. We'll follow up on the questions. Apologies for the technical side. I think Teams is getting tired. I think Zoom is getting tired. 2020 is getting tired, but thank you for coming along and good luck.